So we'd love you to keep your cameras on. We'd love you to switch your microphones off. We'd love you to put your hand up before you speak, and therefore you've got your microphone off. And please use the chat function for your questions. We do have a session at the end that we will pick up some questions and provide some answers from the panel. And I know it's difficult. I know it's the middle of the day. I know there's lots of things that we should perhaps want to be doing. But if you're here, then please just allow yourself to immerse yourself in this webinar. You'll find it fascinating. So my next slide is all about the panel. So let's start off with who's here today. We are absolutely thrilled, Dr. Carrie McCarthy from the World Health Organization, WHO, to be presenting this afternoon. She was the lead for this report, and she'll walk us through some of the key findings. And then we'll hear reflections from our other expert panel, leaders from the UK, Europe, and the global health community. And they'll be bringing their own perspectives to their interpretations of what the report says and means for nursing leadership, education and workforce planning. So on the panel, therefore, after Carrie is Dr. Natasha North, our very own FNF, so Florence Nightingale Foundation, Director of our Academy. Raquel, I'm so sorry, after all of this time of knowing you, I still can't pronounce your surname. And so I'm going to go with Raquel. Raquel is the chief exec in a big organization, a healthcare organization in Iceland. She's also a global scholar. Dorcas Guata is a global health consultant. Her reflections she will be providing on the migration, partnerships and the role of diaspora in our nursing communities. And Howard Caton, who's popping in a bit later on and popping out again a bit later on. But Howard Caton, he is the CEO of the International Council of Nurses, and he's going to be presenting and providing his reflections on the ICN's response to the report and what are the ICN's policy priorities. At the end, we'll close with a Q&A and final reflections from the panelists. And I encourage you all to engage in and ask questions in the chat box. And then we can collectively think about what are the recommendations that we as a community would like to take forward. Particularly, one aspect might be on strengthening the CNO roles and leadership pathways. So whether you're joining us live or you are catching up later, I need to say that this well, it's already started. It's a bit late, Greta. But I need to say this webinar will be recorded. But really, thank you for taking the time this afternoon to join us and join the conversation. Sit back and really immerse yourself in what our panelists are going to say on the state of the state of the world's nursing report. So, Carrie, over to you. Congratulations, thank you. And I know that you're in massive demand for talking about this report. So thank you for agreeing to speak with our audience this afternoon. Carrie, over to you.
Thank you, Professor Westwood. It's a real honor to be here. I'm so excited to connect with the wonderful community of nurse leaders that you have cultivated. So I'm really thrilled. I'll go to the next slide then. And I'm going to go over just a little bit of the context of the State of the World's Nursing Report, why we chose to do it and do it again, give you an overview of what's in it, show you just a few of the key findings, and then talk about what that means for global strategy and policy going through 2030. And I'd like to acknowledge the great support that the Burdett Trust for Nursing provided to make the State of the World's Nursing 2025 a reality this year. Next slide. So this is a busy slide, but you'll see data, dialogue, and decision-making. And that is essentially the paradigm that WHO has been using these last 8 or so years to support countries to engage in this process that can really drive investments and policy actions in the areas in which they're needed. So we really were able to test this theory of change starting in 2019, 2020, when we had the State of the World's the year of the nurse and the midwife. And that really created this amazing engagement across the world. And that engagement was instrumental to be able to have and collect and have countries report data on their nursing and midwifery workforces. We had more data reported by countries than we've ever had in the past. So that engagement let us have really robust country validated data that facilitated intersectoral policy dialogue. And that dialogue is what can then support decision making on where and how to invest in nursing and midwifery to strengthen towards national goals and global goals. And we know that investing in nursing education, employment, working conditions cannot just drive progress on health, which is SDG 3, but also on SDG 4, which is education, and SDG 5, which is gender equality, and SDG 8, which is inclusive growth and decent working conditions. So we were able to test basically in 2020 when we had the Year of the Nurse and Midwife, we had the State of the World's Nursing Report and the State of the World's Midwifery Report. We had policy dialogue at the highest level at the World Health Assembly in 2020, and that's a picture of Her Royal Highness Princess Moon Al Hussein, who gave a really great address in that dialogue. And we had the decision making by the World Health Assembly to request WHO to develop the global strategic directions for nursing and midwifery, which they had never done before. And then the following year, they adopted the global strategic directions with a resounding resolution urging countries to implement and advance the strategic directions and its monitoring and evaluation, so that we really had, for the very first time, a clear global mandate on those policy directions for nursing and midwifery, 2021, 2025. And I'll tell you what those are in the next slide. Here, the strategic, yep, you can go to the next slide, yep. The strategic directions for nursing midwifery are essentially 12 policy priorities in 4 areas: education, jobs, leadership, and service delivery. And these are essentially that we have in education, the right levels of nursing education, the right quality of nursing education, that we have the right number of graduates to meet population needs, and that we support faculty with that capacity and infrastructure that they need. In employment or jobs, we really want to support, we're driving countries to do that planning and forecasting to ensure that they have enough jobs for nurses. That's really how you increase the number in the country, as well as focusing on recruitment and retention and ethically managing international migration. In the area of service delivery leadership, it's really 2 aspects. It is supporting and developing and establishing that senior nursing role in the Ministry of Health, as well as developing the next generation of leaders. And then the last area, service delivery, relates to professional regulation of nursing and midwifery, as well as the working conditions for nurses and midwives. So these are essentially the 12 policy priorities for nursing and midwifery. Next slide. And part of implementing these is also monitoring and reporting. That's a requirement that WHO has, that member states gave it. So we've been working very closely with countries and actually tracking the implementation of the strategic directions. And that's the graph on the left, which is something that we reported to the executive board of WHO. And we see there that there's high levels of implementation of all 12 of those policy priorities. Incidentally, the lowest implementation was in the one that is the WHO Global Code of Practice on the international recruitment of health personnel. So that's the international migration piece. But otherwise, a really high level of implementation of the strategic directions, all 12 of them. And also, we noted that a lot of countries are using the strategic directions as sort of their roadmap or blueprint for developing their own national plans for nursing. So that's fantastic. That is what we wanted to see. However, we are in a new era now. We were just in the last 5 years of the Sustainable Development Agenda. And it's time now that we really understand exactly where we are, because we have a lot of progress yet to make in order to reach those SDGs and universal health coverage within SDG 3. So this is the time, this is the point where we really needed to understand the nursing workforce. We need another clear global, regional, country level picture of the nursing workforce, so we can make the right decisions about where and how to invest to strengthen nursing and midwifery. So those are sort of the objectives of the 2025 report, was to have a clear picture post-pandemic and at this point with 5 years left in the global agenda, and use that data to facilitate planning, forecasting at the country level, and also to facilitate that data dialogue and decision making at the global level, which we needed to do because the strategic directions were ending in 2025. So we also needed to inform that decision making by the World Health Assembly again, to see the progress, see the new data, and decide what to do. So next slide. I'm going to give you just a picture of what's in the State of the World's Nursing Report. Essentially, there's three aspects I'll mention. There's the main report, there are what we call the regional pages, and then there are the country profiles. So the main report is where all the data and evidence and analyses are, and that's both quantitative data, according to a standardized set of indicators that describe nursing stock, distribution, density, and demographics like age and gender, education pieces like graduates and the graduation ratio, and the status of professional regulation, laws, policies, and leadership. And then we also did qualitative dives into some key areas for nursing, which you can see in the boxes and features. So there's a lot there that we dove into, did sort of an evidence summary, and kind of talked about the pressing policy priorities in each of those. And there's many more in the State of the World's Nursing Report. And then what we did is consolidated the data, evidence, and analyses for each region into their own pages. And those are in the annex, and some kind of diving into the subregions as well. And then each country has an individualized profile that is on our website and downloadable in a one-page PDF. So it's really accessible to be able to use for that policy dialogue and engagement at the country level. Next slide. Now I'm going to go into just a few of the findings. I say just a few because our time is short, and there's lots more in the State of the World Nursing Report. So I'd really encourage you to pick that up and dive in. But I'll give you some of the highlights. So we start with jobs. We're going through the strategic directions for policy areas of jobs, education, leadership, and service delivery. And in jobs, here's where we get into some of the meatiest numbers. Basically, the global stock, or the number of nurses in the world, is almost 30 million. And this was an increase from our 2020 report, which found about 29 million. So we saw growth in that period, although many countries did not have growth in that period. It's been very, very unequal. The graph on the right is the density of nursing personnel. And while the average is about 37 per 10,000 people, you can see from the graph that there's a really big difference in density. The blues are higher density, the darkest blue, and then the pinks and the reds are lower density, and the red is the lowest. So you can see there's big differences. Europe is about 77, so much higher than that average. And in Eastern Mediterranean and Africa, those regions, it's 14 and 15 per 10,000. So really big difference there. Our global shortage, though, is currently almost 6 million, 5.8 million, which is, again, a decrease from our number in 2020. Actually, the 2020 number. However, in that period, again, while in our growth to 2030, we will see continued growth, but actually there's, again, not going to be growth in certain areas. And while that density will increase to 42.5 nurses per 10,000, some areas will actually have a decrease in their nursing population. And the growth, the shortage then, even though it is decreasing globally, is going to be increasingly concentrated in just two regions, 70% of it just in Africa and the Eastern Mediterranean alone. So while we see these big pictures of growth, we see really increasing inequities in a lot of these figures. Still in the area of jobs, if we look at demographics, next slide, how it relates to, these are all important for workforce planning in different ways. But we see that most of the nursing workforce is of the professional category as opposed to associate professional. And this has to do with the scope of tasks in the work setting. We have, in terms of age, we have about a third of the global nursing workforce is less than 35, and about 20% is over 55, so expected to retire fairly soon. This, again, has implications for planning of your workforce, for managing my retirement, for ensuring mentorship and institutional memory, that sort of thing. So again, there's also big differences, as you can see, by region in terms of the percent over and under 35 and over 55. In 20 countries, actually, they have more nurses retiring than than are under 35. And most of those countries are high income and in Europe. Another aspect is that gender. It's still a really highly feminized profession, 85%. That's down slightly from 89 in our 2020 report, most reported in the public sector. And then something of interest is the international migration, which is reflected in how many foreign-born nurses are in are working in countries other than where they were born. So the global number is 1 in 7, or 15% of countries are 15% of nurses. The nursing workforce in a country is foreign born. This was really different by income category. In high income countries, it was almost a quarter of the workforce being foreign born, whereas say in low income and low and middle income countries, it was like 3 and 1%. So really big difference there. Next slide. All right, and then in the area of education, we do a lot of these metrics to kind of to help us understand the global education pipeline, essentially. So we look at this graduation rate, how many graduates per active nurses. And what we see there is a little bit of progress that we wanted to see as compared to, say, the World's Nursing 2020. We see an increasing ratio in low and lower middle income countries than in high income countries. So that is good. However, when we look at the sort of the broader pool of the graduates per population, that's still lower in lower middle income countries than in high income countries. We looked at the duration of education. That's the graph on the right. In general, most nurses have a 3 or 4 year education. And these are all sort of broken down by sub-region in the regional pages for you to see a little more information about Europe in particular. We also looked at a number of indicators of education quality. So accreditation, for example, and aspects of accreditation. We also looked at whether or not interprofessional education was a requirement for accreditation, and whether countries were including social determinants of health as part of nursing education. And so you can see the numbers there, that those were the two sort of lowest in terms of those quality assurance mechanisms. And those matter in terms of obviously being prepared to work in the different settings with interprofessional colleagues, as well as keeping that orientation towards primary healthcare and those social determinants of health. And then if we go to service delivery, again, this is professional regulations and working conditions. We looked at almost 20 different laws and policies and regulations. And for the most part, they're not all presented here. Again, you have to go to the report for those. But for the most part, those professional regulations were largely in place for nursing, as well as these laws and policies around working conditions, minimum wages, social protections. We saw advanced nursing practice rules in 62% of countries, and that was an increase from 53% in 2020. And in Europe, 51% of the countries said they had advanced practice rules. In terms of those working conditions, globally, about 60% of countries said they had protections from attack. In Europe, I guess that's 58%. Only 42% of countries said they had packages and services for mental health and well-being of nurses. And in Europe, that was just a third of the countries. We also looked at wages, entry-level wages, both in standardized US dollars and in purchasing power parity. We saw really big differences between regions in terms of the wages by dollar, and then you can see the purchasing power parity graph on the right. Basically, high-income countries had twice as high of wages and purchasing power parity than upper middle-income countries, and 3 times higher than low-income countries. So again, that really big disparity by income group there. And then leadership is the last area, and I'm going to spend a minute more here because it's of such interest to this group. But basically, in this global nursing leadership context, WHO has been working closely with since we work with WHO member states and the ministries of health there, we always have worked closely from the nursing portfolio with the government chief nursing and midwifery officers. And so we have some normative work done on the roles and responsibilities of the global chief nursing midwifery officers, including global nursing, a forum that we do every 2 years with them. In the State of the World's Nursing Report was the first time we could look really closely at leadership. And we found at that point, only 71% of countries had a government chief nursing officer, and only half of countries had a leadership development program. So for that reason, we put the leadership policy focus area in the strategic directions with those 2 policy priorities. And then we had some great leadership from our WHO regional office for Europe, which took that up and did a technical brief on the work of GCNMOs in Europe, and actually developed some typologies about the different types of government chief nursing and midwifery officers, which we then explored a little closer with the global group in 2024. And what this really showed is that while countries might have a government chief nursing officer, there's really big differences in what their responsibilities, what their authority is in the workplace. So whether or not they really can be strong stewards of the national nursing workforce or not. So that was really important work. And then we look at the data, next slide, for the leadership this year. We found an increase. Now there's 82% of countries have a government chief nursing midwifery officer, but we still don't know those roles and those authorities, where they're placed in the ministry, that type of thing, their budget, their authority. We also saw an increase, though, in the presence of leadership development programs. 2/3 of countries have those, which is an increase. But we saw a really big difference in terms of the availability of leadership development programs by income category. So in high income countries, 80% of countries said they had a national leadership development program for nurses, but only a quarter of low-income countries said they had that opportunity. So something really there's a stark difference we need to address. In terms of leadership, we also looked at a globally standardized indicator that asked countries to report within the Ministry of Health leadership positions how many of those are held by women. So we only had this as a new indicator, so there's only 27 countries that responded, but we did have those 27 countries represent all regions, or there are countries from each region in there. Our range I put there from 6 to 100%. And you can see the difference. In Africa, there are 10 countries reported, and they had about a quarter that were female in the Ministry of Health leadership positions, and in Europe, about 65%. So it's an interesting data there that we'll continue to see grow from the WHO reporting. So in conclusion, this data, this analysis of which I've just given you a tiny snapshot, as you can probably gather, there's global level improvements in a lot of these indicators, but we are seeing widening disparities, deepening inequities, and those inequities are really going to impede achieving those sustainable development goals that I mentioned. So what we're doing now is we found that based on all this data and analysis and evidence that the policy priorities within the global strategic directions remain highly relevant. And actually what we did in the State of the World's Nursing Report is identified areas of emphasis for this next period, so that we can, in each policy priority, to focus on to 2030. And we also found 5 additional policy areas to focus on through 2030. And what's really important about the State of the World's Nursing Report is that it's leveraged, that it's used. It's used for that intersectoral policy dialogue. It's used for decision making and driving those investments and policy actions on nursing midwifery. And we actually saw that happen again at the global level. We did the State of the World's Nursing Report. It immediately preceded the 78th World Health Assembly, which looked at that data and then made a decision at the 78th World Health Assembly this past May to extend the global strategic directions until 2030. So we have that in place also, which is fantastic. We can go to the next slide. So that really establishes our global policy agenda through 2030. Basically, we have the 12 policy priorities within the strategic directions in education, jobs, leadership, and service delivery. And then our additional policy priority areas that are articulated in the State of the World's Nursing Report 2025 are in the areas of furthering advanced practice nursing, harnessing and utilizing the power of digital health technologies, advancing gender equity, enhancing the role of nurses in the climate agenda, and supporting nurses in fragile, vulnerable, and conflict-affected settings. So these are essentially our goalposts. These are the areas that we all are working towards in a concerted manner. And in that way, we can really drive progress and be working in the same direction, despite how many players there are in every context, really working together towards these goals through 2030. Next slide. So what that means for WHO's strategic activities and our work going forward, this kind of relates to really WHO's global mandate to respond to that governance by the World Health Assembly. So we just at this past World Health Assembly, there was a really an important resolution again on strengthening the global health and care workforce. So clear actions there urged by the World Health Assembly to the member states, to countries, and to WHO for our work. There was a decision again about supporting and advancing the Global Code of Practice on international recruitment, and then also that decision to extend the global strategic directions for nursing midwifery. So we'll be working with member states and just within the nursing portfolio I'm speaking to, but it's obviously much broader for our support to countries on their health workforce, but supporting member states to use their data for policy dialogue and decision making, and also that national planning, those national investments, those national strategic plans for nursing. We're doing a lot of this work through the end of this year and then next year as well. In 2026 is the biennial Global Partners meeting for nursing midwifery, which used to be called the Triad meeting with WHO, ICN, and ICM, but we're broadening that. That's something we usually hold in Geneva every 2 years. And we also have the Global Forum for Government Chief Nursing Midwifery Officers. There's a photo there from 2024 with the European group working and discussing their data for State of the World's Nursing Report. And then we are also planning to update the roles and responsibilities for Government Chief Nursing Midwifery Officers, given all of the data and the activity and our work with Government Chief Nursing Midwifery Officers. That's something that we want to update to reflect the most recent evidence and the current roles, the actual roles and responsibilities, and something to aim for countries when they are establishing or strengthening those roles. So I'm going to conclude there, and we'll look forward to the questions and for the discussion. Thank you very much.
Thank you so much, Carrie.
Slide about methods.
Oh, sorry, I overspoke. Thank you so much, Carrie. My goodness, all of that work in just 20 minutes. Well, we can't underestimate the power of persuasion and the influence and the negotiating to get that amount of data from all your all the member organizations in one report. But as you say, it gives policymakers, it gives governments a real resource to bang people over the head to do better and ensure that we strengthen every aspect of the nursing workforce. So thank you so much for that, Carrie. I'm sure there'll be lots of questions in the chat box. But now I'm going to move over to Natasha. Natasha, it's all yours. And as you can see from this slide, those that don't know Natasha, she's our Director of Academy at the Foundation. And I'm going to provide some reflections, a different set of reflections based on the State of the World's Nursing Report. So over to you, Natasha. Thank you.
Thank you, Greta, and thank you, Carrie, for setting out the findings of the 2025 report so beautifully. As Greta has already done, I just need to recognise the immense amount of work and also the quality of the personal leadership that you provide in making this happen. The collaboration is on a scale that is mind-blowing, and precision within that kind of collaborative space is such a challenge. It's a really rare combination, and you just achieve both beautifully alongside your colleagues, and I am just always humbled. One of the strongest messages of the report for me is the centrality of nursing leadership in health workforce planning. And that's the thing I will jump up and down about. If nurses aren't at the table, then our workforce plans are likely to be incomplete and unrealistic and not fit for purpose. For me, that's a lesson that I learned very early in my academic career in Malawi. Dr. Chulipoka Soko, who was then the National Director for Nursing and Midwifery Services, mentored me. I would even say she schooled me in the absolute necessity of embracing workforce data and the power that it gives us as nurses. So when we use data with confidence, with insight, with that kind of precision, we move from being, as nurses, the passive recipients of policy to the people who are active shapers of health systems. And that's the essence, I think, of what the State of the World's Nursing Report is calling for. It's leadership that is evidence-informed, that's strategic, that's unapologetic about taking our rightful places as nurses within workforce planning. And that applies globally. It applies at the level of individual nations, and it applies right across the FNF community in our daily work within our institutions at whatever level. So it's something that FNF is hugely committed to advancing. And our global and our UK leadership scholarships are actually a direct response to that call for stronger national nursing leadership, to equip future leaders with the skills to actually engage in that kind of strategic planning. And so it's amazing. I'm reading down the list of people who've joined this call already. I wish I had time to say hello to everybody that I know. But it is beautiful to take a minute to realize that through our scholarships and our leadership programs, I can see alumna of our Aspiring Directors of Nursing program on the call. Hundreds, if not thousands, of nurses and midwives to date have actually got the confidence and the capabilities to bring your insights into the decision-making places. And for FNF, that includes some of the past and the present government chief nurses of all 4 UK nations, as well as government chief nurses and senior nursing leaders from other nations, from Ukraine, from Iceland, and elsewhere. And actually through FNF's global partnerships as well, whether that's in the UK or in Kenya or in Malawi, where we're currently working, we're seeing some really tangible examples of how the right kind of leadership preparation changes not only individual careers, but actually can help to transform whole health systems. I was really privileged earlier this year to author with an amazing advisory group some new International Council of Nursing guidance on involving nurse leaders in strategic workforce planning. Catchy and exciting title. But it sets out a really practical process for embedding nurses into the heart of workforce planning. And I think we're going to pop the link to that report into the chat. So that's there. But for me, just to summarize the implications of this report and what it means for FNF's community, are that we have to prepare nurse leaders for that job of workforce planning. It's not optional, it's absolutely essential. FNF is going to continue investing in creating those nursing leadership pipelines. We can't do it alone. We need governments, we need employers, we need partners and supporters to make that same commitment. And we need to be able to do that together so that when we get together to look at the next State of the World's Nursing, did you say 2030, Kerry? We can say with confidence that nurses are there, they're leading workforce planning at every level, and that our health systems are going to be stronger because of it. Thank you.
Thank you so much, Natasha. I'm just looking at the chat. Please do feel courageous if you're curious to write any questions, curious responses to anything you've heard or questions you need about clarity of some of the things that either Carrie or Natasha have presented this afternoon. But amazing, thank you, Natasha, a real insight in how the FNF is supporting or trying to support with our partners the advancement of nursing leadership at government chief nurse level. Thank you. So I'm now going to introduce you to Raquel. I'm going to call Raquel always because I cannot pronounce her surname and I never will be able to as much as I try. But Raquel is the chief exec of a hospital and health centre in Iceland, and she was until very recently, the president of the European Nurse Directors Association, or EDNA. And I've seen a few people have popped in from ENDA this afternoon on this call. So you're very welcome. And importantly, Raquel was in our first cohort of global scholars. So Raquel, over to you from a European perspective.
Thank you very much, Greta. And so great to see you all on the screen here. But yes, this is truly a flagship report showing the unequal distribution in the nursing workforce. And in some respects, the European region faces what might be described as a luxury problem. Nurse density in Europe is 5 times higher than in the African and Eastern Mediterranean regions. The recruitment of nurses by high-income countries from countries facing greater shortage is unethical. Nurses who migrate can fulfill or fill crucial workforce need in Europe, but may not obtain professional recognition to work as a nurse that is working below their education and training. The big question is this sustainable? And the answer is no. Not to mention the Nordic countries, which have among the highest ratios of nurses. The Nordic countries should be striving for self-sufficiency. But it's important to highlight that the European countries differs. The average nursing density is 77 per 10,000 population, ranging from 28 in the Eastern Europe to 203 in the Western Europe. And Europe is also facing a large number of nurses retiring, which highlights the urgent need, as discussed before, for effective workforce planning. We have to focus on retention, and we have to focus on return into the profession. This great report underscores what we, in a way, already know, but obviously our action has not been strong enough. In the WHO report, WHO Europe report, Health and Care Workforce in Europe, Time to Act from 2022, the message was very, very clear. It was act now. But one can say it is a big difference being a thinker or a doer. But since 2022, Europe has changed a lot. It is important to consider those countries affected by conflict and the impact it has on nursing. Damage to buildings and resources is going to affect healthcare, nurses and nursing education, both in short and long term. Nurses, as well as others, face immense risks, attacks and mass casualties. WHO has emphasized regional and global solutions, and there has never ever been more important time for cooperation and collaboration. Regarding European implementation perspectives, we have to work much closer together. Implementation remains the greatest challenge. It is about collaboration and it is about leadership. It is essential to strengthen leadership both at the institutional, national, regional, and global levels. We need to do more. We need to step forward and reflect on the importance of nursing. The position of Government Chief Nursing Officer is critical in every European country. This must be a person who is visible and respected, experienced and courage enough to drive real change. The DCNO positions vary across the European region. In some, there are no governmental chief nursing officer, and others they hold strong leadership roles and work actively with government and authorities. While in others, the government chief nursing officer experience working alone with a lack of influence, and that must be very, very frustrating. The European nursing associations should work much closer together through designated channels. We need to act now, and the report is showing that we need to act now and work closer together, set clear goals, and map out the path to achieve them. Because as we know, every step in nursing is a golden step for the whole world. So that is how I see this report, and we need to act now and work closer together. Thank you.
Super. Thank you so much, Raquel, and wonderful timekeeping. Thank you. Again, colleagues on this call, any questions, any curiosity that you have, please pop it in the chat. So I'm going to invite Dorcas. Dorcas is a diaspora global health consultant, working with global health partnerships, has been with the Florence Nightingale Foundation, the Mary Seacole alumna. So Dorcas, over to you.
Rita, thank you very much for the warm invitation. And the foundation is extremely close to my heart, having funded me many years ago to do some work in Zimbabwe to inform some of the public health challenges we have with youth knife crime and youth violence in London. And today we're able to do that much more today because diaspora has brought some intelligence and innovation into that huge public health challenge in London. So it's very, very close to me. Allow me to take a very African context and approach to this and say the report allows us to have a conversation. And in a true African context, a conversation is had around a fire. And I invite the audience and participants today to settle around their fire. And in the 5 minutes that I have, we might just have a conversation. And that conversation might just acknowledge the data then and the report, the data that has already been presented. But we might also talk about what are the opportunities. We have huge gaps of workforce in Africa and Asia. Africa bearing the heaviest burden because that is where a lot of the migration is coming. So what are some of the solutions that we might think about in mitigating and meeting some of those gaps? I work for Global Health Partnerships. At Global Health Partnerships, we're very passionate about health partnerships. Health partnerships are fundamentally characterized by government agreements, and it's twinning hospitals and twinning health systems so that they are in conversation, they are supporting each other, there's bilateral conversations, they're co-designed programs. The funding is usually coming from the global north, but it is always determined at local level as to how it's spent by government arrangements. Characterized by MOUs, but is also characterized by diaspora engagement. And some of the best health programs that we have, and we funded at Global Health Partnerships, have been characterized by diasporas. When we include the diaspora in healthcare partnerships, we know that we're getting so much more than just the funding and the impact on the ground. We're getting cultural intelligence. We're getting cultural competences in effectiveness. How do we know that that taxpayers' money that we funded and channeled through from the UK all the way into programs into Malawi, into Zimbabwe, into Nigeria, has effectiveness and has impact? We need the right governance structures in place. And we do that by supporting nursing leadership. And what I love about health partnerships is that they begin to ignite some of the difficult conversations that we sometimes find very difficult to have. They support better bilateral relationships between governments. You might give an example, a health partnership between the UK and Zimbabwe, which I'm currently leading on. The history behind that is problematic and has been marked by aid. And we know that the aid model has been very problematic. And one might ask, how did we do this for so long and carry on with it with very little effectiveness? So it allows us to engage in much broader conversations about how we can support nurses at ground level, It allows us to explore the scope for research. We need to collect some of the evidence base around diaspora engagement. We also need to appraise some of the work that the diaspora does. We know that nurses, 1 in 5 or 1 in 7 who are working in the NHS are born abroad. A lot of those nurses and midwives are going back to their home country. A lot of them will spare 2 days or 3 days of their holidays and when support their healthcare systems. Some of that work is not evidence-based in their appraisal and their development. It's not acknowledged in their work, and a lot of the innovation that they bring to the global north is not acknowledged. So we need to create platforms and policies that appraise diaspora engagement and diaspora involvement. I will peg gender issues around that. A huge workforce, in the nursing workforce and midwifery, are women. Women who are in nursing are working in the global north, and they're sending money back to their home countries. That has an impact on those economies. It has an impact on the children that they send to school. But we know that when a nurse dies, and this is something that I know Howard Cutton is and colleagues we're very passionate about at FNI, Girls Education. When a nurse dies through suicide or is ill or suffers any kind of sort of mental health disorder, that has an impact on the wider family. So there are conversations that we should have around our fireplace about how can we safeguard nursing and the nurse workforce. And I know that this is priority, not just in FNF, but it's a priority at WHO level. I bring this conversation home by saying we need to document a lot of the stories. There are so many stories that we are hearing, we know are happening. There are so many contributions and innovations that are happening in the workforce that are supporting healthcare systems. We need to learn lessons from each other. Those lessons need to be documented systematically. But to do so, we need psychologically safe places to have those conversations. And I'm really excited about some of the work that we're doing in Somaliland, some supporting the diaspora programs through some of the work that we're doing at Global Health Partnerships through Nigeria, supporting a lot of the programs at ground level. I'm excited about some of the work we're doing in Ghana. In Ghana, we're incentivizing nurses who might want to come back, Ghanaian nurses who might want to come back to Ghana, and through registration processes, contribute back to their home systems. This is something that we're really passionate about because circular migration, as we call it, at Global Health Partnerships, and has been supported by IOM, International Organization of Migration, can be effective if it is supported by the right mechanisms and the right policies. So this is a conversation about nursing. It's a conversation about the might and the contribution that we bring to the healthcare system. It's also a conversation about the vulnerabilities that we have in the healthcare system when nurses migrate. But it also is a conversation about how can we better support and appraise nursing, particularly diaspora nursing contribution into healthcare system. Thank you for having me.
Thank you so much, Dorcas. Lovely message in the chat that in there from Martin from Cambridge. Amazing, thank you. And thank you for always pushing the boundaries about what is possible when diaspora nursing midwifery groups are, as you call it, making that circular movement. So thank you so much for joining in. Now, I don't think Howard is on the call this afternoon. I've had a look. My
yes,
colleague...
he is.
Yes. Oh, he is. By magic, Howard. How lovely to see you. Thank you, Howard. For those that don't know Howard, Howard is the CEO of the International Council of Nurses, and we are, as we are with everybody on this panel this afternoon, very lucky to have him. I thought you might have been called over to something even more important than us, Howard, but thank you for making it. Over to you.
I cannot think of anything that could be more important than being with you, Greta, and FNF this afternoon. And I've been listening for a little while. It's lovely to see so many of you. Too many to name, but it's great to be with you. And Dorcas, I was warming my hands around the fire as you were talking as well. So I will try to keep the fire burning. Just a few reflections for me. I know time is short. Do you know it took 70 years, more than 70 years, before we had the first ever State of the World's Nursing report, and I think that says a lot. You know, we have not been centre stage and in the spotlight in the way that the profession should have been. So that was very significant that we had that first report in 2020. But of course, days after we went into 2020, which was the year of the nurse and the midwife, we were hit by the pandemic. And we were seeing at ICN, you were seeing in your countries, in your workplaces, the huge toll that the pandemic took on nurses, both physical and mental health. And that's why ICN said and lobbied strongly for the fact we needed a second State of the World's Nursing report very, very quickly. And Dr. Tedros announced that at our Congress in 2023, and Carrie didn't stop working from that point onwards to deliver us the report, the second report on International Nurses Day this year. But in the same way that the first report was launched into the uncertainty of the pandemic, this report is launched into the uncertainty of war, of conflict, of climate change, and uncertainty for WHO and international organizations under great threat as a result of defunding decisions. The global health architecture is changing. And I think all of this means that we have an even greater responsibility to take and run with the data, with the policy, and with the decision that we had from this year's World Health Assembly. I was there in the room. We'd lobbied from ICN, we'd intervened, and we heard member state after member state echo the calls that we as a profession have been making for more support and more strengthening. And the member states said to WHO, not only must you extend this strategy, you have to accelerate progress as well. Sticking with Dorcas's fire, I think we need to be holding some of the feet of our politicians and policymakers to our nursing fire over the next few years to keep them to the promise to implement the actions that come from the strategy. But colleagues, we are in a lucky place to have it. Honestly, if we were having this conversation now and saying we'd like to have a new State of the World's Nursing report and a new strategy, I think that would be very, very difficult to achieve. So amongst all of the uncertainty, the fact we have both of these reports, we have a strategy, we had a World Health Assembly resolution, we have words from ministers of health around the world of support, is something we need to absolutely utilize and run with. On the numbers, the data, Carrie knows that we work very closely on the report, and I love a lot of the numbers, and I always have to hold myself back from getting into too much detail. What I would say to all of you, it is important to dig into the numbers. This is a mixed picture in this report. Yes, we have a bigger stock of nurses, by nearly 2 million globally, but the shortage has really only shifted marginally from just over 6 million to 5.8 million. Why? Because at the same time the stock has been growing, the demand around the world for nurses has been growing even more. And then when you break down what's happening in the regions, do you know that the stock in Euro, the region that UK, we sit currently, I'm in Geneva, and greetings from Switzerland, the stock has actually fallen from 7.3 to 7.2 million nurses. In the Americas, the stock of nurses has gone down by about 1 million. So we have an overall growth, but we have significant variation. We have some countries who are hugely influential. China, 20% of nurses sit currently in China. China are, putting on significant more nurses each year. That's great, but it can shift and influence when we're just looking at top line, headline figures. And even if we achieve the progress set out in this report, we would still be left in 2030 with a 4.1 million shortage. I don't think it's enough. I think we need to go further than that. We need to drive that figure down. But 4.1 million would still represent 70% of shortages being within the African and EMRO, Middle Eastern region. So dig into the numbers. Don't take any one top line number as a truth in itself. The other area I'd like to flag is some really worrying stats. Carrie's mentioned a few of these, but in relation to what globally we call decent work, pay, and conditions. The fact that less than 60% of countries have policies in place for mental health support, given that we've just been through the pandemic, I think is an absolute shocker, given the fact that actually 40% of countries don't have policies in place to prevent attacks, when we know violence in the workplace is going up around the world. When we look at pay levels, huge variation, but in low-income countries, an average of $4,000 a year, 27,000 in high-income countries. The picture, I hate to say, but it's too much of not of decent work, but of indecent working conditions. ICN did a survey of our national nursing associations, which we published just before the State of the World's Nursing Report, freely available on the website. And we ask our associations, more than 140 from around the world, to tell us how things felt for them from 2020 to 2025. So the extent to which things had improved or stayed the same since the publication of the first State of the World's Nursing Report. Between 40 and 50% of associations said that they saw an increase in nurses leaving the profession. Between 60 and 70% said poor, inadequate staffing levels was a top priority root cause issue, driving so many other issues of burnout, stress, and people leaving. 90% of the world's nurses pay had stayed the same or had gone down. We have a real issue with still not providing nurses around the world with decent pay, work, and conditions, and we need to make much more progress on that. And I very deliberately talk more about the importance of retention at this moment than I do recruitment. But all of those factors that I just mentioned, all of them play a factor and a driver for the patterns of international migration and mobility that we are seeing. Shortage, inequity, variations in pay and conditions, all directly influencing nurses to move and migrate. And that level of movement and migration has increased significantly since the pandemic. And all the indicators in the State of the World's Nursing Report are that that's going to continue or may increase even more. Just yesterday, there was a new report from the WHO European region. And it said that there had been a huge increase in the recruitment of nurses across the European region. And out of all of the nurses who come to the European region, 2 countries accounted for 88% of that recruitment. Those 2 countries were Germany and the United Kingdom. The UK currently has in the region of 23% of its nursing workforce are foreign trained nurses. I know, making a huge and important and incredibly valuable contribution. But the report from WHO Europe, and it echoes very much of what ICN has said, says that countries need to be educating more of their own healthcare workforce. They need to be aiming for self-sufficiency. The workforce planning point that Natasha so powerfully made as well. I just want to think about that figure of 23% of UK nurses being foreign educated just a little bit more as well, because we know that there's a global code of conduct for practice for ethical recruitment, and I never hear anyone say that they are recruiting unethically, but I'm just going to give you a slightly different perspective on what ethical recruitment looks like. And my sort of definition of ethical recruitment, very simply, is if I'm taking, are you giving back in a proportional or an equal way? President of Brazil was in Geneva and caused a stir a year or so ago when he said, well, if you take and you don't give back, that's stealing, isn't it? As I said, that was a remark that caused a bit of a stir. Let's take the 23% of nurses who are foreign born in the UK. I think there's a population of about 780,000 nurses in the UK at the moment. So that equates to about 180,000 UK nurses currently who are foreign born. How much does it cost to educate a nurse in the UK at the moment? When I lived and worked there, we said about 50,000. I don't know if it's the same or if it's more, but if I take 50,000, the cost of educating 180,000 nurses would be a figure of about 9 billion. If recruitment patterns are ethical, how much give back is there to countries who are losing their nurses from recruitment? Does it equate to 9 billion, to 4 billion, to 1 billion? I think we need to be asking the questions around the ethics of nurse migration and recruitment in relation to money as well. Let me move on and do a couple of Ian Jury moment in terms of reasons to be cheerful on all of this. The leadership stuff is really positive. Carrie and others have talked about that, but we don't have enough pipelines for leadership development. FNF, ICN, many organizations in that space doing hugely important work to increase the number and the size of the pipelines for leadership development. Advanced practice, the report says this is a huge opportunity for all countries' healthcare systems as they face the challenges of aging and growing populations and non-communicable diseases. We bring a massive solution with specialist and advanced nursing practice that we should do more of. The world is moving to an all-graduate profession. That clearly is the trend, and we've jumped a bit from 10% of men to 15% of men as well. So there are still big issues of inequity, of course, but there are some really important areas of progress as well. So I come back to I feel slightly like Natasha in terms of workforce planning not being the most sexiest of things today saying that having a nursing plan and a nursing strategy and setting out your clear goals and objectives, a plan to get there, making sure it's costed and having a monitoring framework around that. But it is that sort of hard graft that we need now to make sure we deliver on the report, the strategy, and as I say, to hold some of our policy and political decision makers' feet to Dorcas's fire. Back to you, Greta.
Oh, you do make me smile, Howard. Fantastic. Thank you so much. You make me smile because actually we could have extended this webinar by at least another hour, and we still wouldn't have covered off all of the issues that people want to hear about. Some great chat in the chat box, but actually I've got one question to ask all of you, and that is, you've got 10 seconds to answer it before we have to close. If we were to write, if the State of the World's Nursing Report was rewritten in 2030, what progress would you most want to see captured? Very quick, all of you. Howard.
Listen, we've got zero shortage. We're down to zero shortage. Conditions of work have improved hugely, and we're focusing as much on retention as we are on recruitment, and countries are absolutely getting and behind the power and potential of nursing advanced practice specialist roles, nurse-led models of care, that countries are reorientating their health systems to primary care, to preventative health care, and they're putting nurses right at the forefront of their modernization, of their transformation plans.
Super, thank you. Dorcas.
I would love the report to capture the voices of nurses like Alice in Zimbabwe who stayed. We don't document the stories of the nurses who stayed. And when I asked her, why did you stay? She takes home $400 a month. She said, I stayed because my community needs me. I'd love those voices to be captured. I'd love us to have a broader diaspora engagement policy that acknowledges the enormous contribution that we bring into the global north and the innovation that we take back into our workforce, balancing those two, often with families too. Thank you very much.
Thank you, Dorcas. Natasha?
I would love that report to show that every country has got nursing leaders who are fully engaged in workforce planning at every level. And I would love to know that we've created the pipeline together so that nurses are prepared, so that they can bring in that nursing data, that insight, that expertise, and then nurses aren't only leading in care delivery, but they're actually shaping the future of our health systems.
Thank you, Natasha and Carrie. Last words.
So I would absolutely love to see even better data, even more robust data on all the indicators. I can't pick favorites, but that robustness has to come from the engagement of all types of nurse leaders in a country through that process that ensures that we have validated data that's really able to disaggregate and paint an even more detailed picture. And I would really hope that that detailed picture shows a lessening of the inequities that we saw growing from between the two reports, and so many indicators around education and employment and accessibility of those inequities decreasing significantly.
Thank you so much, Carrie. I wonder, could you just take the slide down?
And Raquel, Greta.
Yes, I just was aware that we weren't seeing anyone's faces.
Oh,
well, I wasn't, if everybody else wasn't. So, Raquel, how about you? What would you like to see different?
Just short. The power that we have to hold together as one profession is our biggest hope for the next years to come. That is my message.
Oh, thank you. What a note to finish on. Listen, I want to thank every single one of you for joining this webinar this afternoon. The point is that there were so many of you that stayed, even though we are 9 minutes late. There are so many of you that stayed on until the last few seconds. A super subject, a super panel, and we thank you all very much for contributing this afternoon. And I think as a community who've been on this webinar, we need to pull together about what we can do to support the stock, the retention, and all those other things that are part in the report. They show inequity across the nation, across our nations, but there is so much to do, and we can do that. We can be part of that journey, but we'll do it if we are. Because we are global nurses, we will be able to achieve this. Thank you all so much for joining. Thank you to the panel. Thank you to my team, and have a fantastic rest of the afternoon. Really well done.
Thank you very much.
Thank you all. Bye-bye.
Bye-bye.
Bye.